Bismillahirrahmanirrahim. Assalamu alaikum. My name is Hafiza Laiba Khurshid. My roll number is BP1650073. The drug which I am going to talk about is Capreomycin. Capreomycin is a peptide protein synthesis inhibitor antibiotic which is obtained from Streptomyces capreolus. It is given intramuscularly and intravenously as a second-line agent for multi-drug resistant tuberculosis. MDR-TB is caused by bacteria that are resistant to at least rifampicin and isoniazid, which are the most effective anti-TB drugs. Indication: It is indicated in multi-drug resistant tuberculosis in combination with other drugs. Mechanism of action: It inhibits bacterial protein synthesis by binding to 30S and 50S ribosomal subunit. Side effects: Capreomycin is nephrotoxic and ototoxic. Tinnitus, deafness, and vestibular disturbances may occur. The injection causes significant local pain, and steroid abscesses may develop. Dose: For adult, 15 mg per kg per day to a maximum of 1 gram per day is recommended for 60 to 120 days initially. For people 60 years or above 60 years, 10 mg per kg per day to a maximum of 750 mg. For children, 15 to 30 mg per kg per day as a single or twice weekly dose. It is category C for pregnant women. Drug interaction: Capreomycin may interact with drugs like amphotericin B deoxycholate, cidofovir, atracurium, cis-atracurium, and neomycin peroral. Capreomycin toxicity: In case of capreomycin toxicity, hypokalemia, hypocalcemia, hypomagnesemia, and an electrolyte disturbance resembling Barter's syndrome have been reported to occur. Alternatives of capreomycin: Amikacin and kinamycin can be given in place of capreomycin. Fluoroquinolones and macrolides are also given. Irrational use: The irrational use of capreomycin led to the emergence of resistant strains of M. tuberculosis. Treatment of MDR-TB is very difficult and has been based in the use of fluoroquinolones and injectable antibiotics such as capreomycin. Consequently, strains resistant to the later drugs, so-called extensively drug-resistant strains or XDR, have recently emerged. XDR tuberculosis is very difficult to treat, and the prognosis is very close to that of untreated tuberculosis with a mortality rate that can reach up to 50 to 100%. Alternative brands: Capreomycin is available as Caposit 1000 injection by McLeod's Pharmaceutical Private Limited. It is also available as capacitate sulfase injection powder for solution 1 gram 1 ml by Acorn. It is also available as capacitate sulfate by Eli Lilly and Co. Limited. Case study: Patient DS is a 30-year-old male who was admitted to the hospital after 3 days of coughing up blood, profuse nocturnal sweating, loss of appetite, and hyposomnia. He stated that he was diagnosed with TB 3 months ago and started on a regimen of isoniazid, rifampin, pyrazinamide, and ethambutol for 8 weeks, followed by isoniazid and rifampin 7 days per week for 24 weeks. His heart rate is 110 per minute. Respiratory rate is 20 breaths per minute. Blood pressure is 130 by 76. His chest radiograph indicates bilateral infiltrates with well-defined cavitating lesion of the left apex. His sputum cultures are positive for AFP. in the organism identified as tuberculosis resistant to isoniazid. How does information change your recommended drug combination and duration of drug therapy? Subjective. Chief complaint is coughing up blood. Duration of chief complaint is for 3 days. His age is 30-year-old, tender male, history of illness. He was diagnosed with TB 3 months ago. Current medication includes isoniazid and vampin. Objective. Vital sign. Heart rate 110 per minute, respiratory rate is 20 breaths per minute, blood pressure is 130 by 76. His chest X-ray indicates bilateral infiltrates with well-defined cavitating lesion of the left apex. Sputum culture. M. tuberculosis resistant to isoniazid. Assessment. DS current regimen should be re-evaluated. The patient should be referred to a specialized treatment center. Plan. Since the culture indicated resistance to isoniazid, he should be started on a regimen of pyrazinamide, ethambutol, or fluoroquinolones, which can be Cipro or levofloxacin, and injectable agent Capreomycin for 8 months. Okay, these are the references from which I have taken these information. Thank you.